Good afternoon, all. Welcome to Cedarcrest's 73rd annual meeting. We really wish that you were here with us at the center, but certainly given our pandemic circumstances, we know that this is the best that we can do. I hope for some of our friends and supporters that the virtual opportunity actually makes it easier for you to attend. So we're glad that you're all here with us, and I know that over the past 7.5 months, you have been behind us, and certainly the staff and all of us at Cedarcrest Center have really appreciated the many ways that you have supported us during challenging times. Before I go on too far, I'd like to introduce Cindi Coughlin, the chair of our board, who will start the business meeting. Thank you.
Thank you, Cathy. Good afternoon. I'd like to open by welcoming you to the annual meeting in celebration of 73 years of service to the children and families of New Hampshire and neighboring states. Each year, we highlight the changes that have occurred, and this year, as you can well imagine, have been unprecedented for the staff and each of us. As I look back, I'm happy to say, however, that the one thing that has not changed is our mission and the delivery of outstanding care to the children we serve. I want to thank Cathy, the leadership team, and the staff for the personal sacrifices they've made on behalf of the children this year, and the community, each of you, for the exceptional support we have received in so many ways over these past months. Earlier today, the Board of Trustees held their business meeting and approved the minutes of the 2019 annual meeting. This year, we have 3 trustees who will be retiring from the board that I would like to thank and acknowledge. The first is Becky Provencher. Becky has been on the board since 2016 and has a past history of working at Cedarcrest. She has shared her clinical expertise as a member of the Quality Practice Committee and has participated in the selection of the Knox scholarship recipients. Alan Mendelson has been on the board since 2011. He has shared his extensive expertise as an active member of our finance and investment committees over the many years. Donna Dunlap has also served on the board since 2011. She's the past chair of the Development Committee, served on governance, and is the retiring secretary. In addition, Donna has consistently represented the voice of our parents and families throughout her service. All 3 retiring trustees have agreed to stay on our advisory council, which we are extremely grateful for. I'm happy to share we have 3 new trustees joining the board this year, and they are Jackie Ethier, Richard Skeels, and Pam Wilder. The following slate of officers was approved by the board for 2-year terms. Chair, Cathy Wilbarger; Vice Chair, Tom Bennett; Secretary, Cameron Tees; and Treasurer, Kevin Forrest. Cedarcrest is also so fortunate to have support from members of our advisory council. In addition to our 3 retiring trustees, Donovan Fenton will be joining the advisory council this year. I will now turn it back over to Cathy for presentation of today's awards.
Thank you, Cindi. So each year we recognize 2 champions, one an organization and another an individual. We are very fortunate to have so many champions for the children and for the organization. This year, for our organizational champion, it was unanimous when we were considering this that we recognize the Emergency Services Unit of the Department of Health and Human Services, also known as the ESU. They have been there for us as we built our supply of personal protective equipment, responsive to our needs. Their role is to be a resource in emergency preparedness, response, and recovery activities from all hazards. And certainly with COVID-19, the availability of PPE or personal protective equipment has been key to all of us. They work in collaboration with the state's Emergency Operations Center and have provided support, coordinating the planning and resource needs to distribute PPE throughout the state. We are so grateful for their efforts in the procurement, dissemination, and delivery of this personal protective equipment, helping us to mitigate the impact of COVID-19 on our children and our staff. The support we received to protect the children who have such complex medical needs has really been phenomenal. We know that it requires considerable coordination for us to receive, for us and other providers, to receive the personal protective equipment, and they never hesitated when we called or put in a request for additional PPE. We're very grateful for the hard work of the ESU and want to recognize the staff and the affiliates that are involved with the staff. There are many people who work within the unit, including Michelle, Lee, Craig, Stephanie, Sam, volunteers, and the staff of the Civil Air Patrol and the New Hampshire National Guard, as you can see in the photographs. We also want to thank Carol, Diana, Zoe, and Sean for their background support. I know that there are many state departments who were behind the scenes in the provision of personal protective equipment where needed, and we certainly appreciate the support of the ESU in making sure that Cedarcrest Center was prepared for whatever might come our way. To date, we received 30,000 surgical masks, 6,600 N95 masks, 6,600 gowns or overalls, and 8,000 gloves through the ESU PPE disbursement. It really helped to ensure the health and well-being of the children and staff. So we are very, very appreciative of this team. And as you saw in one of the pictures, they actually came on site so that the children could see the truck and understand where these supplies were coming from. Our second champion is an individual champion, someone that we've known for many years, Dr. Lou Guill. Dr. Guill helped us to pilot telemedicine for the children's pulmonology visits. As we've cared for children with more complex needs, it has been critical that the children be seen by pulmonology, and prior to our involvement with telemedicine, this meant two staff accompanying a child to Dartmouth Hitchcock, bringing along the child's ventilator, oxygen, pulse oximeter, and whatever other equipment was needed. And it was a large task, a great commitment of time and staffing, and really took its toll on the children as well. So when Dr. Guill proposed that we do visits via telemedicine, we were delighted. We started, one at a time, and it has evolved to a quarterly clinic where instead of one child making a trip to Dartmouth-Hitchcock in a half day, we now can hold a clinic with 8 to 10 children being seen in that same amount of time. And the children enjoy, because there's a screen involved, they enjoy their visits with the doctor more than they ever did before. Again, the pulmonology services that Dr. Guill offers have been critical to our ability not only to care for the children, but to help them move beyond the limits of their equipment, and in some cases, we've been able to wean children from their support of a ventilator. We appreciate Dr. Guill's commitment and support in helping us to refine the process of telemedicine visits. We now have many other specialties that the children can see through telemedicine, and it was Dr. Guill's, leading the way and supporting us through that. And one of the values of telemedicine visits is that we can engage additional staff in the appointment, and it really increases the value of the visit with the physician. So thank you so much, Dr. Guill. And we have plans to deliver a memento to each of our champions in the future. So I'd next like to present the Margaret Knox Endowed Scholarship. For those of you who have been involved with Cedarcrest for many years, you'll know that Peg Knox was our Director of Nursing for over 40 years, truly a champion in care of the children. One of the things that she was very supportive of was the education of our staff. And she often would encourage individuals to get their prerequisites done or to apply to nursing school. Look at what might be in your future. And when Peg left, we decided that the best way to remember her legacy and the commitment that she made to staff development was to develop this endowed scholarship. Many of you have contributed and continue to support that effort, and we really appreciate it. We have 2 staff that are being recognized today with a scholarship. The first is Kirsten Nichols, who came to us originally as a volunteer when she was in high school. She assisted with children's activities, and when she had the opportunity, completed a nursing assistant course. She came on board as a staff member in 2017 as an LNA, and has been working with us since then while taking prerequisites for nursing school. This year, she was successful in completing those requirements and in being accepted to River Valley's RN program. And she is very excited to move toward the next step in her professional career. In the applications that were reviewed by our selection committee, one of the nurses wrote that Kirsten is a confident and compassionate LNA who's really gotten to know the children well and is perceptive and very responsive to their needs. Her professional curiosity and compassion will be great attributes for her as a nurse. So we're very pleased that Kirsten is one of the next recipients of the Peg Knox Scholarship. Our second recipient is Jordan Pandia. Jordan joined our staff 2 years ago while she was in high school and came on board as a residential assistant. In this role, she was supporting the needs of the children and the nursing assistants. So she was in this support position and with major goals to engage the children in activities, foster their independence, and certainly keep them safe. Jordan, Jordan not only did this with, a wonderful sense of purpose and commitment, she also brought high school students that she went to school with here to volunteer. So she shared her love of her work with her peers and encouraged them to join her at Cedarcrest. And I think that was, very special times for the children and the high school students. Jordan was noted in her application by one of the supervisors to, always actively engage the children and foster independence and ensure their safety. She is now enrolled at Worcester State University, and she is starting on a career in communications with a goal of becoming a speech-language pathologist. So she is on her way, and both young ladies were very pleased to be chosen for this scholarship, and they join a relatively long list of individuals who have received scholarships. With the help of one of the nurses, Lori particularly, looked back at staff that Cedarcrest has supported in their education. And in my tenure here, there are close to 60 individuals who started with us as a residential assistant or as a nursing assistant, who've gone on to become nurses, therapists, or other healthcare providers. So clearly, PEG's goal of promoting staff development, of encouraging staff to move on to be the best that they can be, has really been a part of our culture and our engagement with staff. We do our best to be flexible, and that's really necessary. We currently have 18 students on our evening shift. They bring great value to our staff, and we flex around their school schedule so that we can have the benefit of having them with us, and they can have the benefit of the experience. So I really want to reach out to Peg Knox and her family, and thank you, Peg, for instilling the love of learning in all of our staff. And I also want to thank those of you that contribute to the Peg Knox Endowed Scholarship for your continued support in making such scholarships happen. So thank you. I'd like to turn the program back over to Cindi. Thank you.
Thank you, Cathy, and congratulations to the award recipients. It's always just such a pleasure to hear about them every year at the annual meeting. Before I go in to talk a little bit about our presentation tonight, I want to formally conclude the business portion of our 73rd annual meeting. Amidst all the changes this year, the trustees and leaders embarked on a strategic planning process. As you can imagine, incredibly challenging, particularly for the staff during this pandemic time. So for the past 10 plus months, we've been working with Helms & Company to develop a 3-year plan that would take us from 2021 through the end of 2023. And I'd like to share a few highlights about the process and the plan that will be approved by the board in November for a January implementation date. I want to first acknowledge the hard work of the Strategic Planning Committee members that you see on the screen. They've worked diligently with our consultant to assure a plan that would carry Cedarcrest into the future. Our first steps in the planning process involved the gathering of a significant amount of information and data to identify trends that would require our focus. We completed a board governance survey to identify opportunities for optimal performance by the board. Our consultant, Ellen McCann, interviewed key partners from many agencies and organizations in the field of healthcare, managed care, special education, government, and advocacy. We also interviewed parents. We completed a management and trustee survey to identify strengths and opportunities for improvement from an inside perspective. We finally researched medical trends and anticipated future needs for children with complex medical issues. What we heard loud and clear was that Cedarcrest continues to have a strong reputation for caring for children with complex medical needs. The staff was frequently commended for their skill and expertise, and everyone we spoke to and who participated in the surveys agreed that Cedarcrest was a valuable resource that was needed for years to come. We were also able to identify opportunities to strengthen what already existed, resulting in the identification of 4 focus areas. The first area, organizational effectiveness, we will focus on things such as organizational culture, efforts to become an employer of choice, and leadership succession planning, to name a few. Under individual and family experience, some key areas will include further program enhancements to meet the changing needs of the children, enhanced communication with community and school partners, and transition to a new electronic medical record system. Operational sustainability is not a new focus for us and has been in many, if not all, of our past strategic plans. Continued efforts will be focused on census, case mix, and optimization of funding in an effort to assure a positive margin that's so necessary for our sustainability. I do want to mention that the growth in community support this year has been admirable and noticeable. It is so appreciated and necessary for our future success. External relationships and communication is a focus area that is connected to each of the other priority areas. The Development Committee is working to identify strategies that will support the goals and objectives in each of these other areas. We are also currently developing a detailed work plan with target dates and metrics that will help assure the success of the plan and will also be approved by the board in our November meeting. We look forward to sharing more with you in the future about our strategic plan. This concludes the formal part of our presentation this afternoon. Cathy and I would like to make a few closing remarks, and I'll turn it back over to Cathy to begin.
Thank you, Cindi. So, Mission Possible. That's the theme of our meeting, and you saw it if you received a postcard or an email. And it really is very fitting for this year, like no other. I think that, as we faced adversity, and, again, Cedarcrest was not alone, but the staff have been absolutely amazing. We have worked hard to keep the routines for the children as normal as possible. I'm sure the kids at first really wondered why the heck everybody had their face covered up, and as we went through the different changes in requirements for PPE and required of our staff. But staff did not bat an eye. They have adjusted to the continual changes based on the information that we've learned from public health and other partners. And we would not be as far as we are in managing through this pandemic without the great teamwork and support of every staff member. We worked hard to strengthen our communication systems so that everyone had the information they needed in order to provide the care or support services that were needed. So the staff were a big part of that mission possible, but I have to say that we are so fortunate to have children who brighten our day every day. And they kept us all grounded and focusing on what we needed to do to support them. Didn't matter if, there was a challenge in front of us. It really, everyone has been so focused on the children's needs. And now we're very pleased that we're able to support their families with planned visits. Originally, those were outside, and we've just begun indoor visits, and we're really excited to have connections with families back a part of our work. We follow closely all of the guidelines from public health as well as Centers for Medicaid and Medicare, CDC, and also licensing and certification. So there's a lot to put together, but our attitude has been mission possible. We just keep forging ahead to make sure that we can get through this. The notes and donations, food, little care packages that we received, especially in the early months, which were kind of dark months for us. Not knowing what was next. We were locked down in terms of no one else in the building, and I can't tell you how much those small things, they may have seemed small to you, but they really kept staff going. I also want to note that, we all have staffing challenges. It's been the nature of our world, and that's shifted from low unemployment to high unemployment. But I have to say that we have been very fortunate to bring on a number of new staff during the period of this pandemic. Staff that have just joined right into the team, who share that commitment to the children and helping them to grow and develop. And I really have been amazed by that. One might think that people would shy away from healthcare, but I think we, as other healthcare facilities, have seen potential employees really step up. And I want to thank those newer employees for coming on board and joining our team. I also wanted to acknowledge, and I think Cindi alluded to this, but our walk and roll this year was amazing. And we weren't sure as we began our planning, how can we do this without having you all invited here to our campus and to walk through the community. The theme of, walk and roll wherever you are caught on, and we had just great support and have, we're closing in on $35,000, over $10,000 above our goal. And it's really because of all of you. It was an amazing story and participation from so many people, and I really want to thank you. So as I started, and I think have alluded to, it's been a year like no other, and we certainly hope that it will not repeat itself. We're trying to look ahead to 2021 and know we've got a ways to go to get there, but we're looking forward to the brighter things ahead. I also have been reflecting on my tenure at Cedarcrest, which is now 25 years. And I've decided that 2021 will be the year that I will retire. And I'm looking forward to working with the board as we identify the next leader for this organization. And clearly, we want to keep that focus on mission possible and doing all we can for the children and families and staff. Thank you.
I know that this is really big news, given Cathy's history and successful leadership at Cedarcrest. And while we will have plenty of opportunity, I hope, before Cathy's transition, I want to officially thank Cathy for her outstanding leadership and commitment to Cedarcrest, to the staff and children over the past 25 years. She will be greatly missed by many, but is so deserving of a wonderful retirement, and we wish her well. I do want to assure everybody, like Cathy said, that we are immediately embarking on a search to carry on Cathy's legacy and to find the person that will help move the organization forward with our new strategic plan and assure that Cedarcrest is here for many years to come, as everybody was so vocal about how important that is. So I would like to thank you for joining us this afternoon virtually. This, again, is a very different experience for each of us, and want to really finish by also thanking you for your tremendous support of Cedarcrest and the children. It's very much appreciated. Thank you very much.